Hello, my name is Ashley Booth. I'm a student at Nightingale College, and today I will be performing the insertion of an NG tube on my patient. Prior to entering the patient's room, I will have washed my hands. Upon entering the patient's room, I have already gathered my supplies, which is my NG tube, my syringe to measure the gastric output, and then we're going to use that to the gastric contents, so that we can measure the pH of the gastric contents. I have my barrier, I have my basin with warm water in it. I also have my tape, my lubricant, I have my pen light. So I will go ahead, and I've already applied my gloves. I will go ahead and inspect each of my patient's nostrils. I am looking for any deviated septum, any type of cleft lip, or any type of occlusion that would prevent me from getting the tube down there. I would then go ahead and occlude one nostril and have the patient breathe in. Occlude the other nostril, have the patient breathe in. I am doing so to check again to see which nostril would be better for me to insert the tube. While I'm doing this, I will have placed my NG tube in warm water. And then now what I will go ahead and do is measure from the tip of the patient's nose to the tragus of the ear, and then down to the xiphoid process, and I am at about 50 centimeters. My tube is labeled. If it was not labeled, I would go ahead and place a piece of tape there. So now that I know approximately how far I need to go down, I also have my stethoscope on me as well, so that I can check for placement. Now that I have measured, I have assessed the patient's nares, I have measured from the tip of the nose to the tragus to the xiphoid process, and I know I'm at about 50 centimeters. I have prepared my tape so that I can go ahead and tape the tube to my patient's nose. I also have my paper clip or clip so that I can go ahead and attach the rest of the tubing to the patient's gown. I have made sure that suction is available at bedside. Now I am going to go ahead and dip the tip of the tube into the lubricating jelly. Okay, and I'm going to go ahead and begin inserting the tube. Okay, go ahead and as I'm inserting, okay, every 2 to 4 inches I would go ahead and tell my patient to swallow. If I meet resistance, I would remove the tube. If the patient begins to cough or gag, I would also then remove the tube. If I do meet resistance, I would go ahead and attempt the other nostril, but I would give the patient a break and allow them to take small sips of water. So I would tell them to swallow, swallow, swallow. Okay, and also it may help if the patient puts their chin to their chest to help the natural flow of the tube down into place. Okay, I'm gonna keep going here till I reach about 50. My patient is tolerating this procedure well. This is not the first time they have had an NG tube inserted. If it was someone's first time, you obviously want to look out for the coughing, the gagging. It is a very uncomfortable procedure. Now I'm going to go ahead and just tape the tube in place on the patient's nose. I am going to go ahead and pull about 30 mLs of gastric content. Okay. All right. I am going to go ahead and place this in a separate little cup. And that I have placed in there. I will discard my syringe, and then I'm going to use a pH test strip to test the pH. I ideally want the pH to be between 1.5 to 3.5. At this point in time, I'm going to inform the doctor and get an order for an x-ray of the chest and abdomen to ensure proper placement. And now that that has been done, we have assessed and made sure that placement is appropriate. It's where it's supposed to be. I have now attached this to the patient's gown, and I have attached the tubing to suction. I have ensured that the tube is patent, it's suctioning fine going into the suction canister. I am going to go ahead and document the amount as well as the characteristics of the fluid that is going into the suction canister. And then I'm going to ensure that my patient is still tolerating appropriately. And then I'm going to go ahead and lower the bed. I will then again, I don't want my patient to be completely flat. At risk, they will be at risk for aspiration at that point. So I will keep the bed at a 30-degree angle. I will have the bed in its lowest position, or position that is comfortable for the patient. I have reassessed my patient. My patient is still tolerating everything appropriately. They're not complaining of any pain other than the initial trauma of the tube going in. I will then go ahead and document my findings, the amount, the characteristics of the fluid that is in the suction canister, ensure that the suction is set to where it needs to be, and also date and time the syringe as well as the tubing, as the tube does need to be replaced every 12 to 24 hours. And then I will again perform hand hygiene, thank my patient for allowing me to perform the procedure, and then I will exit the room and doff my gloves. I will remove my gloves.